A hearty good afternoon to everyone, and welcome to a session on emotionally focused therapy and fertility treatment. We are pleased to have Dr. Vijaygeeta Patangi among us today to educate us on this topic. She's a clinical counselor with a PhD in clinical health psychology, and she can help shed some light over the symptoms of depression, grief, and high level of anxiety that people experience while facing infertility. Doctor, you have the stage.
Thank you. A very good afternoon, everyone, and welcome to the presentation for today. We have another interesting topic, which is emotional focus therapy, and this is also related with fertility. Most of us would be wondering, or you would have been wondering, why emotion focused. Everybody know that. Um, yeah. Everybody knows that emotions are very important, and something that we see very common in a reproductive population, mainly because as a couple the planning of expanding the family will be there, but the frustration of why the family expansion is taking time, and despite the biological parameters are all correct, there's still the dream has not come true, and there's a lot of emotion that gets entangled around that. Surprisingly enough, the thought process of the person who is being subjected to most of the fertility or the infertility treatment would have this rewiring of thoughts that goes into or leads to a person to a traumatic experience, thereby affecting the emotions gravely. These emotions definitely have an impact on hormones. So there's a lot of studies that is being done on this. So why are we doing this situation or dealing this situation is mainly because of you. If you see, you are surrounded with lots of ideas or plans, and that every of that idea has some emotion, like let's say for your job, and you have a career and you have a prospectus that goes on. So when you are planning and trying to achieve, so there is a sense of happiness, contentment. Your everyday challenges that keeps you on your edge. There's a lot of emotions around that, and if you see, knowingly or unknowingly, you're addressing or accepting all that emotion. Like, you're not throwing tantrums at your boss, you're not reacting to your everyday work towards your co-fellow people, you are not aggressive or aggression showing or being aggressive to your subordinates. Basically, you're doing right, because the moment when you achieve, it's like when the sense of achievement comes, you embrace to say, yeah, that's a good job done, and then you appreciate yourself first, and then your team, your members, and then there's an hike associated, which is basically a positive reinforcement to say that, okay, because of this achievement you are getting this. Overall, there's an acceptance. Basically, they're all comprised of your plan, which all has emotion. So moment when you understand, you're able to deal with it. So you, in your health parameters, if you see, what is your today's goal? Probably today I would like to have a bhel puri, and you have all the emotions associated with bhel puri. You're not just going to gobble it and throw it away. You're going to say, I want it like this, in this way. I still want the crumb. I want to enjoy the lingering of the taste. I want to have that aftertaste in my mouth. I'm not going to have sweets. So there's a lot of plan and associated emotions. Why? Through that activity, you wanted to enjoy those emotions. Otherwise speaking, you are accepting them. When it comes to, let's say, the most intricate health issue, keeping away whether it is going to be fertility or infertility, as simple as, let's say, we are all common now wearing eye spectacles, right? So there's associated headache. You want to watch your very favorite movie, but the moment your staring at your screen or staring at your device, to my understanding that you're straining too much in watching the monitor, or you're tending to lean forward, and I don't see that you're too much involved despite it's your favorite serial. Something is wrong with you. So the moment your partner or a person who is in your vicinity or in your premises who says this, you tend to listen. Oh, is that so? Then we let look into it. And then when it comes to the picture that, okay, there's associated headaches, I'm not able to actually see. Only if I sit here, I'm able to see. When all this picture comes to in the present, you started understanding that there is an inability. So you trying to transform from it. Do you continue to do that? Do you continue to go sit no near to the TV monitor and start gaping at it? Or are you going to read your newspapers like this? No, right? So you take the relevant steps or ask a person what needs to be done. So if you ask your friend, she would say, go get an eye test done. Somebody would say, are you having anything else beyond just a looking problem, associated headaches, pain, something else? So who do you need to see? A simple eye testing and wearing a goggle? Or do you really need to go to an ENT specialist, to doctors? We get to decide. Where are you getting discussed all that? Common discussions, your friends can help out, your colleagues can help out. Serious health conditions, you go to that respected health counselor who will make you understanding based on your signs, symptom, your inabilities, what is lacking, trying to identify your things, and then say, hey, there are 4 to 5 indicators that you have discussed with me, highlights a point of you meeting an eye expert. Oh, is that so? And then the person or the health psychologist would say, you take the call. So you go back, you sit, you reflect, you understand, to bring into the transformation of as simple as wearing a eye goggle or eye specs, to you need something to be done to your physical eyes, gets resolved by meeting the appropriate person. So it is all associated with you. But when it comes with the lack of understanding, or you're adamant and you do not want to transform, or you do not want to hear about it, is where there is an internal tug of war. Like the moment anybody says, why don't you meet an expert, it's like you give him a look. How dare you tell me that? Mind your own business. And then it says, or without buying the point, it say the most of the scenario or the inability is because of you. So you start pointing to the others. There is an imbalance. So the emotion is the most important factor that underlies, because one gets to choose what one would like to experience in their life or in their day-to-day activity. So emotions not only affect the psychological health, it also impacts the physical health, and one of the most important parameters are hormones. Okay, let's look at what this emotion is all about. It's basically a subjective expression. So if somebody says you are looking at the TV like this, or you are tending to lean forward, or you're squinting your eye, you're narrowing, your eyebrows are coming together, and there is a difference in the facial expression exhibiting stress. When somebody says that, you're like, oh, is that so? So that's a subjective expression. And that comes out of a non-conscious change of a somatic status, like somebody is telling something, so there is cognition. And since it is an expression, it is outside of you, which is in your social place, so it is a context which is evaluated, and it is always raised out of either an internal or an external stimuli, where you get to decide, I will respond, I will listen, I will smile and say, okay, let me look into it, or I can grin and say, mind your own business. All that comes to the picture. So actually the word is defined from Latin, emover, and gradually in English it has been translated as emotion. And there are various states of feeling that results into psychological and physiological changes. This actually influences a behavior. So your expression, either through voice, through your face expression, to as dense as a physical body expression, using your body either as a defense mechanism or in any other way. So the influence basically lies in your emotion. Okay. So according to David Mayers, a human emotion involves physiological arousal, expressive behavior, and it's a conscious experience. The moment when somebody says like, how dare you tell me that, your face expression changes, you are aggressive, and you just become furious. In that fist, sometimes you might use your fist. Okay, so that's a conscious experience. The decision making happens faster because your understanding is, I'm repeatedly hearing the same only from this person. I have lost my patience. So I've lost my tolerance out of that. And the person doesn't want to stop there, but he's continuously using the same manner to stimulate me. So that expression comes out. A lot of cognitive understanding also goes. Hence, an emotion is actually a complex state of feeling. That is the resulting out to physical and psychological changes. And this is predominantly the baseline that influences a thought and an associated behavior. It also involves a psychological phenomena like a temperament, personality, mood, and motivation. So let's say you're a very calm, poised person, and then there is this person who continuously comes back to instigate you, and then you say, you're angry inside, but you just show a calm face like, I'll look into it. It's cold outside expression, which can be out of your personality. You can grin or you look at his eyes and say, mind your own business, out of your temperament. That state of mood, like let's say you're actually in a well relaxed state and you heard a temperamental topic, or you're already, your mood is elevated or disturbed because of something else, and then he just comes and says something, you just throw out. So various factors does involve in and acts as a motivation. Where does all this analysis happen? The analysis of all this happens in our brain. Emotions are created by our brain. In the most important factor for that is our decision making. So one gets to decide, which is the brain, through the bodily sensation, past experience, current experience, and then there are so many networks on various levels of, what do you feel at that time, what was going on, and then there is a minimum expression of either as or happiness, or it can turn to be a surprise. Either he'll be in a complete sad, or it can be an anger. So these are the basic four emotions. So according to the one of the studies which are actually initially started, identifying with. And the key element that supports or makes such an emotion come out with that subjective experience, the physiological and the behavioral response comes, which regulates one's emotion and the memory associated with that. So, what influences a person either to be happy or to sad or to be either afraid or surprised or angry or disguised is all partly your subjective experiences of the past. So, your emotion and memory goes hand in hand. Time by for all of me, she's my very best friend. No matter what tantrums is thrown beyond your tolerance level, you just can't feel angry towards the person. Or my best friend, I have all the rights to show all my emotions with the person. There is an understanding, despite no matter what I tantrums or behavior is expressed, the bondage is not severed. So that is what influences. So there are few lower and higher brain functions that involves that influences an emotion. There are visceral responses that changes an emotion, something like motivation, mood, sensation towards a painful factor, and also the pleasure. So if you see the brain, what we talked about is nothing but our limbic system, where the pituitary, the hypothalamus, amygdala, hippocampus is the area where the basic drive for the emotion and memory comes to the picture. Your memory is more processed in the hippocampus area, and something that would trigger, hey, I have to fight for the situation, or I will fly from the situation, comes from an amygdala, and your hunger, pangs, or thirst, your body temperature, pleasurable, displeasurable symptoms, regulating, thus all this gets regulated in your pituitary gland, and also hypothalamus influences these conditions. These are the four major areas in a person's brain that involves in deciding to like, okay, I will think about it. So your decision is to put a pause. I am not looking at you. So decision is already done. So the decision is continue just swing away from your bondage. So the decision making done at that moment. These are the four important physiological factors that function and then exhibiting such a behavior. Our limbic system, very beautifully, is a set of structure in our brain that controls an emotion, memories, and the arousal. They are regions in the brain that detects fear, bodily controlling the body's function, and also perceiving the sensory information through other things. There are also other important structures like amygdala, hippocampus, thalamus, hypothalamus, basal ganglia, and the cingulate gyrus, which are parts of our brain, are closely involved in our functioning of emotional factors. All these components work together in our brain towards an important process of this decision making and exhibition of a behavior. So if you look at the image here, so the perceiving of the emotion leads to an automatic influence in the response. Like you're understanding, if this is the emotion, if I'm seeing a person smiling at me, my perception is he is smiling despite how stressful the condition is. So I'm using a similar way to facilitate my cognitive process. So what is he thinking during the stressful event? This leads to deeper focus on how emotion can be gradually or eventually separate out of your thought and reiterate the thought related with this emotion. Thereby, you can negate and transform. Predominantly, this is what a therapist would try to do. Understanding encourages the thinking on a person about the implication of an emotion. Let's say for it's a simple example, if it is too technical to understand, there's a piece of cake in front of you. You show it to a baby, so that's a grabbing. You give it to a mature person, he will look at the cake and he'd appreciate, wow. So he would appreciate how it is presented and the decoration. Mentally, there will be thought process on the flavor based on the appearance and the smell and the perception. He would think how tasty it can be. If the hunger pranks is not there, or if from the hypothalamus or the hippocampus was that from the hypothalamus, if the signal has not gone, like the hunger control is there, I will eat later, but I liked it. And there's a lot of thought process that goes to decide that yes, I'm going to enjoy this piece of cake. I want to eat it in this way. I would need to relish. This is a new piece. In the meantime, through other information processing is based on appearance, smell, and presentation, you come to a conclusion, oh, the chef is like this. So a lot of information that is gathered will be exhibited on various parameters. What are your emotions there? You feel happy, gradually you might become joyous, you get excited, you get curious to know who did it. So these are the arrived form. But you cannot do the same every time with a person who exhibits something different. So the thought process, associated emotion, if they are mingled like this, the functionality is easy. What if the thought process, like if a person flashes, don't you have sense disturbing me, and he shoos away and the pastry just falls off and the person gets affected. So this is also, a person can behave this way. Managing and encouraging the feelings, like anybody can manage and encourage. If this is the case, through reiteration, by separating the thought associated with that emotion, needs to be done so that any person who walks in should be greeted in a particular way, not just showing it off. So the emotion, when it is separated from the thought, is easy to manipulate or convert the thought. This is where entire system of thinking, emotion, the brain comes to a picture. Emotions like fear and love are carried out and is actually located in our parts of the brain, which is in the center. The emotional processing is done in the amygdala, which receives the input from the brain functions, memory, and attention. So, in brief, this is what I have tried to explain through various examples how a thought or an activity from the perceiver's viewpoint, from the behaving viewpoint, from the viewer's viewpoint, how it can be analyzed. Why are we looking at emotions? Or let's see some of the theories of motivation. What is it actually happening to you? You are actually encouraged or actually motivated for a better behavior. See, there were two options that was discussed. You can smile at the person and receive the pastry, or you can just show away the person and the person says, don't know what is wrong with the boss and he must be in an altered state of mood. This is understanding. So how you want to behave, that's the motivation that comes in to do something better tomorrow. If you continuously are aggressive or very emotionally hurting others, or in you're behaving in a manner that it is not pleasing others, obviously people will not respond to you pleasing you. They will respond to you in a displeasant or an unpleasant manner. On the whole, the most important factor that is supposed to happen between two human beings, which is communication, gets strained, severed, lost. So, what are the few of the theories of motivation that comes to the picture? So, basically, it's on physiological, neurological, and cognitive. Physiological theories is studied under how the body responds towards a possible emotion. Neurological, how one's brain responds towards an emotional response. And cognitive, what are your thoughts that arise out of the activity that happens while exhibiting the emotions? So these are the three ways. So how does one would know? Let's say and immediately a person comes and then there is an exhibition of behavior. This is physical. Or if let's say your brain is thinking and your brain is deciding, if I see this person only I will shout, if I see this person I would smile, if I see this person I would get out of my chair and greet him. So these are all the cognitive function goes on. Or I would sit and just think over it. Oh, this emotion is good, and I will associate this emotion to this person so that I will have a better communication response. So you are going to use your cognition to do the role playing. These are the types of motivation that one would apply in moving forward. These theories were actually more text based, which have been retrieved from the textbooks. Evolutionary theory was proposed by Charles Darwin, where the emotions are basically an adaptive role. They motivate to respond to stimuli, respond correctly, and basically it relates with the survival instinct. Two, James Lang theory. His theory was more again on a physiological reaction, which is basically on events. And according to him, it is dependent on how one interprets the physical reaction. Let's say one person hits the other person. So if the other person gets violent and hits back, or the other person can decide, probably there is a misunderstanding. I would hold myself back, think about it, and then I'm going to behave. So this person of expression of behavior uses a lot of cognition. So James Lang theory's study is all about how one person understands and transfers the physical reaction. Cannon-Barth theory, where emotions results when the thalamus sends message to the brain response, and which stimulates and at the same time also receives signals from the emotional experience. Oh, I will smile at him, and then there is a response. Hey, yesterday also you smiled at him, but he whacked you. So this is where a memory comes to the picture. The association of a memory of the past was more encouraged according to Cannon-Barth's theory. Sachner-Singer theories, where stimulus leads to physiological response. This involves cognitively interpreted and labeled results of an emotion. The critical factor is situation and cognition interference that is being used. Your cognition appraisal theory. I would come in the morning, do my work, behave like this, irrespective of what, and try to do my best. At the end, you get an appraisal. The moment you know this path would lead to this, and there is an experience, there is a memory, there is a calculated behavior that leads to a fruitful reaction. So this is what is all about, which was proposed by Lazarus. Sequence of event which stimulates like a chain reaction. You do this and then you do that, you do that and then you do that, leads to a good response. Facial feedback theory was also connected in expressing an emotion. Specifically, Charles Darwin and William James were noted towards this theory. A brief theories practically that we look into in a subject wise. What are the types of emotion that one would express? So if you look at the chart, there are some expressions which are in a low control basis. Then there are expressions of a highly controlled, like you have your control where you get to decide. So decision making is something that comes to the picture. Also, there are other emotions felt, but then you get to decide whether you want to experience it or experience it and not express it, or you will do whatever you feel like. So, expressions like pity, sadness, worry, embarrassment, guilt are all expression that has a less control over one person, and it is easily seen. The moment a person is having a worryful thought form, it does reflects in the face, like there's something that's running in and he doesn't want to speak about it. Sadness or despair, like somebody or a very close or a loved one is not there or is suffering, it is really reflecting in the face, and we're like, what is wrong with you? And then he said, I'm sad because my friend is undergoing this and I do not know what I can do to elevate out, right? Similarly, highly controlled emotions are like disappointment, envy or jealousy, disgust, and irritation or anger. We have a lot of anger management therapies and um, uh, you know other therapies which would increase happy emotions or emotions that would build in a good rapport for a communication, for a better communication and a better execution, than severing of the relationship, and that by the entire work is being lost. So if you see, there's a lot of emotion that comes to the picture that also has a plethora of various factors that is interrelated and available. If you see, not only a grief is just a grief, it can, the ultimate is grief. It can as simple start from a pensiveness is like, yeah, I don't feel like mingling, to there is a sadness that is taking a piece of my mind and I'm completely being involved in that, gradually leading to grief. Now I don't want to come out of the state, and the person continues to grieve, that the duration of the person spending in this emotion tends to become longer. So though it starts with small and it becomes large. So now we have come to know there is a brain for a better health of mind. Emotion also is an important way to do it. And how to control, oh, I was able to control an anger, how to relieve out of it, what to do, how things are happening. To a great extent, I have understood. But where will all this understanding take me? Getting back to that far, let me see if there's any questions that can be answered. Any questions you can post, and we'll see if there's any question. Okay, let me go ahead then. There are four important therapies that, as a therapist, I would like to use: experiential therapy, person centered therapy, systematic therapy, attachment theory. Let's say a person would have undergone an experience, and because of which the behavior is not so appealing to the others, like slamming a door is a common thing, right? But every time the person, when the door is actually banged accidentally, goes for a shock. This is very simple. You say, what's big deal? So among couple who do counseling and identify has a emotional trauma associated. So, on an individual session, when you identify there is a particular behavior whose associated emotion is not so pleasant, and it is an experience, it's a live event. So you go down only quoting the experience or the emotion associated with that, and you try to identify the thought, and then how you would alter the emotion, or for this emotion, what is a better way to deal? You alter the thought. This is an experiential therapy. Let's say the slamming of door initially is a common behavior, but the person was subjected to severe domestic violence where the slamming of door was more related to a person being forcefully being locked inside a room. The door gets involuntarily banged, which is closed, forcefully closed and locked. So the slamming of the door and the banging of that door matches by sound. Thereby, there is a trauma. So the thought of, even if the person is out of that event, out of the house, out of that locked room, working, still that slamming of door, which raises such a noise, takes the person to that event. Oh my God, am I being locked again? Actually, the person is in the office. So you re-experience the person through experiential therapy to reiterate it back. This is just a gist. If it is one person who is affected, like a person-centered therapy, we will look at the person for an overall development. We identify all the disturbing emotions and thoughts, and we try to alter it. For a systematic therapy, we would look that every emotion is systematically managed. For some person, for no rhyme or reason, they'll be just smiling and giggling. It's one common thing. There's also attachment therapy, the emotional attachment, which becomes unwholesome and not more related. So, some of the things that we look on therapy based, and why we need to look is very important. First is to reflect, to distill out the process from within, to bring in a differentiation, and then thereby a better exhibition of emotion, or practically a behavior will come to the picture. Two, how you, the affected part, is reassembled, and you alter it with a new emotion, brings in a newer version of a person. You turn out those new experiences into stepping signals, like you show, see, when you start behaving, there is also change within you and your environment. So you start enacting and then bring in confidence, and thereby building it further. Similarly, using the same way or the method, you will explore each experiences in a new way. Then finally, you conclude the therapy by integrating it, validating it, and say, hey, this is how it has been working for this emotion. Why don't you apply for the others? Always remember, for a therapist, it is two to tango. Both the person and the therapist should go hand in hand, for which information, which is the key part, plays an important role. It is a highly individual therapy, and even if it is a partner, ethically they are not allowed in the session unless or until a psychiatrist assigns to do so. So this is how basically we focus into. What are the common assumptions when it comes with emotion? Immature, doesn't know how to behave. She is like that only. You don't know anything. So why are we looking into emotions? Some common behaviors that we see in a healthcare area is uh, couple would come. Predominantly, one of the partner will only be speaking for all the questions asked by the consultant or even a healthcare counselor. That itself would bring in an attention. When the question goes to the partner, again the counter partner would be answering. So when out of curiosity, why aren't you answering? So one partner is completely mum and the other partner is completely vocal. There is a striking and imbalance here, but not more exhibited out. People are not accepted by their partners in whatever way they wanted to be. So the common deadline or tags that we listen is, oh, she doesn't know how to say. Well, the person knows how to talk, right? You say in your own mother tongue. But there is an insecurity. Along with insecurity, there are also vital information about their own health which does not get to the ears of the consultant. So that is why emotional focus therapy assesses people on few of the assumptions. We always see that whether partners play their equal role, not only by sharing their emotion as experiences or events. What is their version is very important. Remember, counseling is always two-way. You cannot listen to one person and do a therapy to the other. Communication. When a person is talking, what he is talking, which is the information, you need to identify the source of the information. When the person is talking, how he is orienting with the person, and what are the immediate responses that is coming out is very important. And the most important part is the understanding part. So, according to him, when a person smiles, this is his understanding, the vital immediate meaning is very important, and also how much control one has on oneself. These are most importantly assessed either directly or indirectly on people, because negative emotions can stem from anywhere. It can be primary or it can be secondary. So, among let's say a treatment seeking couple, there is a distress between them mainly because of the communication. Two, lot is being told, assuming that all this is not required to be discussed with the consultant or a treating doctor. Most important aspect of knowledge is being denied there, which can obstruct a planning of a treatment. There can be emotions of anger, disgust, jealousy. I am feeling sick, my partner is healthy, frustration for repeated treatments to be failure, and many other negative interaction that keeps coming again and again because the treatment cycle has to be on a regular. So the negative feedback or the negative input of a positive event would deteriorate a successful event. Attachment towards the needs to others would become very difficult. Thereby, seeking the right treatment becomes a big hindrance. So these are the new things or the old things that need to be altered so that we can bring in fruitful experiences. Among treatment seeking couple, we all know that hormones play an important role. The role of hormones is the immediate expression. So, when there is a hormonal fluctuation in a person's body, and if they are subjected to, let's say, any of a fertility or an infertility treatment, to bear in mind that their emotions are also not in a balanced state. So, it's like a common saying, "Oh, the lady is pregnant. Don't shout in front of her." So there's a lot of advice that goes to a pregnant mother, like, not to watch violent movies, not to see or be in areas where there's a lot of fight and disturbance. Try to be in a calmful, peaceful area. They'll always see that the house is also peaceful, less noisy. They will motivate the lady to hear some devotional songs or chanting, so that the assumption that the baby is also hearing, which is true to a greater extent. Why? We are trying to handle the emotional component. So for every experience, to experience a positive emotion associated with that is an environment that is being created. So emotional focus therapy purely focuses on an emotional component. It's an action tendency based the therapy itself is that, where we motivate the person to alter or change the negative aspect to a positive aspect, and immediately there is an appreciation or an appraisal scene. So once this initially begins, gradually the person who is emotionally upset finds the path and starts applying to other parts and to move forward, which is basically the motor component or the behavior. On the whole, there is an entire change in the physiological behavior which comes to a support. Thereby, there is a better interaction with the consultant, better interaction with the healthcare, better interaction with the treatment line itself. We can have a better understanding on the treatment line improvement. If there is something derailing, we can identify and move forward. Ultimately, the bondage between the treating doctor and the treating couple is well maintained to go through the nuances or various parts of the treatment seeking couple. What would be some of the things that can be causing a disturbance is sometimes certain impact, or let's say, sorry, this treatment is a failure, the word failure would escalate a negative cycle. Oh, no matter what I have done is not going to bring in a fruitful result. So tomorrow, even if there is a positive indicator to say why don't you try another time, it would not reach a person's mind to plan accordingly. So always identify the unacknowledged emotion or patterns and procedures, positions to see where you are attaching to what. For this particular thought, I would attach an emotion like this, or I'm already frustrated. How would you convert the frustration into a joyous activity? So changing interactional pattern is one of the most interesting way. At the end of the day, try to consolidate and integrate your understanding on the day. So today was overall okay. To most of the events, I was very joyous. So the feedback loop in our brain system, it says for this thought, because I behave like this, you're reiterating with a positive emotion, there is less stress involved. So actually, you're de-stressing yourself by identifying unwholesome emotion and trying to transform them. So this is a small way of how a negative interaction, if it is when it is identified, accepted, you say from tomorrow onwards, I will do this kind of an emotion, which is a positive way of expression, would bring in a chain reaction, thereby converting all your vulnerable situations or experiences into much benefiting. The some of the surviving behaviors, what can be some of the behaviors, if you can question, it would lead to a greater sense of protection. Destructive emotions can be altered and they can be removed or transformed, incorporating into positive emotion like, yeah, I know my subordinate always is crank. So I will decide that despite he's cranky, I'll give him a smile. So this is reiteration. And there are sometimes even you are vulnerable. Like today, I'm really not keeping well. I would decide to reject certain things and probably get back to those certain things. Sometimes to transform, you need time. So in such approaches, you can reject and then you can get back. And how would you reproduce such an emotion? Is like you approach, you see if it is very productive, and then you enhance this approach. And then you integrate this to other behaviors. Every day you have to have some time of yourself to understand how this pattern works, so that it releases a sense of curiosity. Wow, it was amazing today in my office, only two people would talk, like 10 people spoke with me, and there is a positive vibes in my own cabin. I like to have this every day, and this comes to the picture. Similarly, one can also do it in one's personal life. When there is a right communication, if curiosity is addressed, when the consultant says like this is how a treatment procedure would be, and the decision of, rather than becoming sad, I become joyful enough, okay, let's try once again, and then you accept, you reiterate with a pleasurable event of your future, which is a dream to have a family. You retreat and then you reapply the same chain reaction to move forward. Why are we looking into the infertility cycle, um, specifically with emotions? The entire male physiology or the female physiology is revolving majority around the hormones. Hormones are closely related with our emotions, or sometimes we can say directly related. So, from the onset of puberty, a girl is always trained to handle, to take care, to pamper, and to move forward. So, there are various stages in her life where sometimes an immediate change would bring in a fruitful result. Sometimes a change that been done prolonged time would bring a fruitful result. Sometimes it could have become a habit or the change, but it has never brought any result. So those is what are the major milestones in the life. If there is a painful period, somebody would have advised take a iced coffee, take some uh, home remedies, eat nicely or sleep nicely. to the extent of your gynae, you've crossed all that, you just need a painkiller. Whatever is the decision, your expression, and your acceptance of that new behavior has relieved you out of that. So you're continuing that behavior. Next time my pain threshold hits, I'm going to do the same. So you're happy at that moment. Your menstrual phase is like that. So then you enter through marriage and then you get into planning of conception. Now, this is where a lot of frustration or inability or sadness, grief, the disheartening of, let's say, miscarriages, all comes to the picture. There's a commotion of emotions. There's a lot of mood disturbances, and also there's a lot of hormonal fluctuations. So that is why emotional focus therapy is very important to address the situation, to bring in that positive loop. So once we put a person back into a positive loop, which is very important, such conditions of derailment or taking a wrong decision or postponing or procrastinating of the planned treatment, or it sometimes affects the outcome of the treatment, all this can be seen overridden with the proper emotion handled. So the therapy plays here a very important role, which I've been since the beginning explained what is the emotion focused therapy, what actually has been done, briefing up of a therapy and its importance very specifically among family seeking population, if I can put it in this way. If for a brief understanding, if you see, infertility treatment is itself like a journey. Initially, the identification can be just fertility issues like a PCOS or irregular menstrual cycle, or as simple as something that would have a painful periods. Gradually, the fertility issues can become infertility issues like a fallopian tube block or a cyst or something more. And this is where once understanding becomes very important. Where, as I said really in the earlier stages, one's personality, the emotional quotient of how you will take up when your consultant says something, and how you would react very specifically, your decision making for a treatment proposed becomes very important. So if the core is well taken care by just following simple instructions, the right medications, treatments and treatment follow-ups, there is always a fruitful result that is foreseen. And a summary, if we see that if we understand your emotions, be curious to know what are your impatient and patient areas, talk to a relevant person for your honest really real emotions that is being attached. You sometimes can't be completely quiet because all your partner is talking to the doctor and you just nod their head. So every time that's not going to be true. Accept the reality and then try to alter one emotion with the others. So if you want to have a very good understanding of where you are, whether you're looking for a fertility treatment seeking couples or an infertility treatment seeking couples, we have a panel of doctors here in Apollo CM Fertility that would be beneficial to the plethora of various major and minor treatments that is available all related to fertility and infertility. With that, I would take a break here with this session is ended. Thank you.